Hi guys, welcome back to the channel. I've got something really super special for you today. It's the day you've all been waiting for. It's the home roast. So, basically what that means is Dr. Kishan is going to rip me to shreds. Are you ready?
Well, first of all, Sarah, I've got to say, what are you wearing? I mean, did you get it at Furnitureland? Or, I don't know, DFS? I don't know, but that is one hell of an outfit, isn't it?
It's the Queen. Don't worry, I will get you back for that next week when I'll be doing him, okay?
So, I think with your lovely face here, I split the face into thirds as well, and I sort of work my way down. Sarah, there's not a lot to do, is there? I mean,
No, there isn't.
It's not exactly a compliment, but it's just, I think, where would I put it?
It's already been done, hasn't it?
I think it's been done, but quite nicely. It's I don't know who your injector is, but I suppose the only area I would say is perhaps here, sort of traditionally the marionette zone. That's the thing that I would suggest. There's a little bit of shadow here in the ala fossa, and that area just next to the nose. Sometimes I think just a little bit of volume just here and here might just lift the features a bit and reduce some of the shadow. I mean, in real life, I suppose, yes, I would do that actually. But the cheek is the contour, the profile is really good actually. I think it's well restored, well volumized.
You know what I've noticed as I'm getting older is right here, the lateral part of the eye, you see it's just starting to tilt downwards, more so on this side than on the other side, I think.
There's that asymmetry there, isn't it? I mean, the aperture is a little bit more, I'm not sure which side. I think I like this side more. Interesting. You've got more upper eyelid show on this side.
Yeah, that's something which the internet has been kind enough to point out to me repeatedly, probably for the past 6 months, that the eyebrows are not quite the same on both sides. I know they're not the same on both sides.
But what do we say? They're sisters, not twins, right?
Sisters, not twins.
Yeah.
I do have, I think, a bit of forehead hollowness, which you can't really see it there. But look, in person, it's here.
A little bit there, actually. There, it's sort of laterally.
Yeah.
But it's very minor.
Minor.
Yeah.
It's there.
And that might be the reason why the brows. This might be the reason why you guys have pointed out the brows being of different heights. And I suppose if we just did a little bit of product here, it might give you a bit more symmetry. In fact, it does.
Yeah.
It does the trick. So yes, okay. Let's think about a little bit of volume there. I think this side is fine, by the way.
I agree.
Yeah. Right. The interesting thing here is, I think this. You know, if we were looking at this without seeing you in real life, we'd probably think that you needed to have a little bit of volume replacement there.
Yeah.
However, I think it's purely it's a question of skin quality, or the depth of the skin there, because it's showing through the underlying muscle and the underlying soft tissue.
I think there is maybe an argument for the tiniest bit.
Tiniest. Because as close as I'm getting to you, wow, this is uncomfortably close there, Sarah. I'll get into trouble. It's really not what's shown in the picture.
Yeah.
Do you agree?
I agree. It looks much worse here, I think, than in real life.
I think it's just the feature of the light hitting the blood vessels below the skin. But your skin's quite translucent. In fact, you have got great skin, haven't you?
Thank you.
Clearly genetically blessed is our Sarah. Should we have a look at the other profile, or anything else?
I'm just going to say, I would do skin tightening for me. Because, you know, I've got quite a full face, and I do think that would be nice. And also, I do agree here, I think there might be a bit of a crease across the chin.
Yeah.
Not huge, but a little bit. And personally, I'd like to see a bit more volume in the lower middle third of the lip.
I'd like to address the neck as well, I think, because you've had treatment in the submandibular region, submental region before, but I'm thinking perhaps one of the focused ultrasound treatment or something like that for skin tightening might be of benefit. Have you had Botox there before?
I've done the DAO and the Mentalis. I don't think that I've had my platysma. Don't think so.
So I think we should do the full neck Botox.
Okay.
And perhaps, I think maybe we'll probably need a little bit more DAO, but I will do the full neck Botox, just see if that allows the face, the facial elevator muscles are in balance with the depressor muscles. So if we knock out the depressor muscles and just see what happens. I mean, it's a bit of an experiment, but let's try it. So
I just noticed I'm getting my
you're
fabric.
molting on me. The sofa's molting.
So mean. Don't go and see him.
So this is interesting, isn't it? I mean, in dynamic smiling, you've got almost no lateral wrinkles at all around the eyes, have you?
I wonder
Very
why
interesting.
That is.
Yeah. But what is actually interesting and what is a mystery is the asymmetry in the smile. So the right angle of the mouth is dropped a little bit compared to the left, and in fact the low incisors are showing on the right. So it's just an interesting thing. I think you've got a different muscle pull. Now it also looks a little bit restricted. So I was going to ask you if you've ever had Botox in the jaw muscles and the masseters. No, because sometimes that particular pattern of smiling, I see that after the masseters have been treated, when these extra little muscles here called risorius have been affected, and it restricts the smile. So I think what would be nice is to perhaps think about increasing the volume of the lips a little bit, just a bit.
Do you hear that? Somebody else said that I need a lip filler as well.
But I mean really, really subtle.
Have that, internet. Have it.
And your face can take it, because if we're talking about the golden proportions, the lower half of the face will allow you to have fuller lips, for sure. Right? So let's do your lips. Cheeks are great on smiling. I think they're fairly symmetrical as well. Do you agree?
Yeah. Well, not too bad. Not too bad.
And we want perfection, but I think we're quite happy with this level of symmetry. And you can still see that the brows are slightly different height there.
We should fill that, I think. The forehead. I mean, we should do that.
So you can see that marionette zone that I pointed out earlier much more readily, and also the loss of volume here in the what they call the piriform fossa or the alar fossa. Just the base of the nose, we just want a little bit more volume there. Cheek is fantastic. I actually think perhaps we could try a little bit of extra definition there.
Please.
I think your face would take it, actually. And also it can give a nice sort of camouflage for when people have a little bit of extra laxity of the tissues underneath the chin, and just to give that a little bit of a stretch in that direction. What do you think?
I totally agree. And also, don't you think the lateral eye is really showing there?
The thing is, I think that we would try a drop of teardrop, very soft teardrop filler here and here as well, but more to sort of rehydrate rather than obviously volumize that area. What do you think?
Yeah, totally agree. And I do agree about the lip as well. I think that would be quite nice.
Lips certainly. That would be really nice, just to project them a little bit further. But in other news, I mean, if you look at that face, that's a fantastic shot, guys, isn't it? It actually looks like she should be on the face of a coin.
And I do actually have my own coin. It's a cryptocurrency called Tonks coin. You can buy it right now on Kex.
Really?
Bitfit. No, I'm joking.
I'll believe anything. Clearly.
Completely worthless.
Wow.
Totally worthless. But we do have masternodes. It's quite an in-joke there.
And here we are with your side profile view. I have to say, I think, again, for me, it's this area here. I think we're going to achieve a little bit of lifting by treating that region there of the cheek. And just try to lateralize things so that it takes some of the lift, it lifts some of the volume away into a more attractive region. Similarly, I think we should definitely do the angle of the jaw. Just there, right? Again, we've pointed this out. I mean, I think it's very, very similar to what we said before. I actually think the forehead looks great in this view. but it's on the right side that I think we want to touch up. Chin is great. We've got very good projection of the chin there. Now, here.
Thanks, Mum, for that.
Yeah.
It was worse before. I had lipo, like actual lipo.
Wow.
God, when was that? When did I do my lipo?
God, I totally forgot. I think it was 3 years ago.
No, it was longer.
I remember
It was
your...
about 4 years ago. It was worse though, wasn't it, before this? Even when I was skinny, it was worse than that.
It's just genetic, though,
Yeah,
isn't it?
it is.
Submental fat. So, okay, so you've had lipo.
Mm-hmm.
Tell me the truth. What do you think about focused ultrasound and sort of our non-invasive treatments?
I
for that?
thought for that specifically,
Mm.
it wasn't great. I thought it was good for the face. The problem is with this region, it's very tough to treat. If you don't do anything, then it's just going to get worse and worse. So you have to hit it really hard. The thing that worked the best for me, apart from the lipo, was the Aquilix. So I had
Right.
1 round of Aquilix there, and also into the jowl fat as well. And that did give a slight reduction, but of course it would be nice to see more.
So I think from knowing you for a long time now, I did notice sort of that jowl area was a lot more. It was a little bit loose, a little bit heavier previously, and now it's almost non-existent. So that definition is good, but yeah, there's no harm in defining a little bit more at the angle of the jaw. But yeah, I think maybe Aquilix, definitely. You should try that. So I suppose in summary, you're going to need about, I don't know, 100 millilitres of filler. Let's budget for that, shall we?
Can you give me special discount?
Oh, absolutely.
Family discount?
Absolutely.
The doctor discount? Okay guys, so that's it for this week. I hope you enjoyed the video. If there's any comments, questions that you have, please just let me know in the comment section below, and we'll see you again next week. See you later.
Bye.